I'm here today with Dr. Stephen Sinatra. He is a leading integrative cardiologist, nutritionist, and anti-aging specialist. I am very pleased to have Dr. Sinatra here at this table talking with me about hip replacement surgery, a very common procedure of which more than 193,000 occur each year. In fact, Dr. Sinatra is among that number, having recently recovered from hip replacement surgery. Dr. Sinatra, it is a personal pleasure, given that we go back 15 years writing, editing, and publishing content geared to empowering people to take charge of their health. Welcome.
It's good to be here, Donna.
But first, why are hip replacements so common?
You know, it's a good question. And the first thought that comes to my mind is we're an overweight society. We're an obese society. And if all that weight has to rest on our hips and knees, something's got to give. So it's perfectly natural to have osteoarthritis or degenerative arthritis because of extra weight bearing. So that's my number one cause.
What's involved in a hip replacement surgery? Actually, what happens? What is the mechanism that's going on there?
Well, first of all, you can have a total hip replacement like I had. My hip surgery was due to a lot of multiple trauma. I used to be like an athlete in high school all through college, and I skied, and I did a lot of things. So I had osteoarthritis. So the end of my femur, that area was really broken down, and there was no cartilage in the hip joint. So I needed a total hip replacement, which means taking off the end of the femur, you know, that little ball joint you have, and putting in a new acetabulum, and it was lined with, you know, some gel and some fiber, some fibrous mesh. So that's total hip. There are other lesser involvements, which include shaving the hip or shaving the femur and maybe using like a ceramic cup. But mine was total hip because I had far more extensive degenerative arthritis.
Is that the more common, the total hip replacement?
Yes, I would say it's about 70 to 80% more common than the partial hip replacement.
And is there any difference between men and women?
No, but if a male fractures a hip, he has a really bad mortality figure. There's like 25% mortality in males. Females do better with fractured hip that require hip replacement.
Does it depend on their age, or is there any?
You know, I needed surgery 9 years ago, 10 years ago, and I fought it off. And I was saying to myself, I'm too young to have hip replacement surgery. But I had it at age 63, so I just feel that it was time for me.